Good afternoon, ladies and gentlemen. First of all, I'd like to thank the organizing academy for the invitation to talk about chem products which can be effective with chronic patients with infections. We will talk about it the whole day. I hope there is some energy left because I'm the last speaker, and I hope last but not least. This is the content of my lecture. I first will be talking very shortly about some infections, pathogens, because we did hear a lot of that today. I will talk about therapies, more chem therapies. I will mention some studies because the theory is interesting, but we like to see how those chem things work in practice. In the end, I will come to the conclusions, and if there is some time left, we can do some quick questions and answers before the questions and answers session. So, there are more steps to do. We heard today it's very important to know which is the main pathogen, what are the main symptoms, but we also have to deal with co-infections, and we have to deal with a poor functioning immune system. And normally I see with chronic infections a lot of toxins. Toxins from the environment, from the food we heard, very scary story, but also of course produced by toxin producing microbes. And in the end we can use others depending of course of the complaints or the symptom of the patients. Is there an inflammation? Is there a lot of pain? Is there a lot of fatigue? So there are more things to cover than just focus on which microbe and which antibiotic. We did already see one of the meanest is of course, and there are a lot of relations between the Borrelia and more than 300 other causes of diseases. And he's very mean, but he always has friends. That's in my opinion. I see it in studies more than 50%. So we already discussed this, so I will go on because of the time. If we look at the therapies, there is of course a traditional medicine like normal pharmaceutical antibiotics. And the first choice is always, and we saw this has also a broad spectrum against the co-infections, is normally the first choice is doxycycline. And if we have a pregnant woman or a child, of course, it's amoxicillin. We can use IV, ceftriaxone. So this is what you all can find in the literature. What's important is to follow the islet guidelines. I visit it every year. And I was very curious 5 years ago. They started with the islets for Europe. It was the first time, it was in London. And if someone tried to ask questions about chemotherapies, that was forbidden. That is strange, and I'm glad that in the couple of last years, when it is held in Augsburg, there's even a day about chem remedies, and there are a lot of guidelines you can find about chem remedies with Lyme associated diseases. Important to show you this picture because it's already discussed, but it's always good to see. If a Borrelia in the spiral form, you give regular antibiotics, it will immediately, in 10 minutes, will change its form and will form granulae to protect its DNA material. So because of this picture, you can imagine that if you give a normal antibiotic too short, so 2 weeks, 1 month, it's effective in those days, but afterwards the Borrelia will come out of the rest form and will start duplifying, and you have the symptoms back. In Holland we say normally it's post-Lyme. So in Holland it's forbidden to give antibiotic treatment longer than 3 months. But if you look at the multiplying time the Borrelia needs is 24 hours, you have to treat at least 1 or 2 years to get rid of it. So you can imagine 3 months is always not enough. So we have to find other ways to treat not only the Borrelia but also the co-infections. Okay, other possibilities? Yes, in nature there are a lot of antimicrobial herbals. We need treatment for the co-infections because we saw today we don't have only to deal with the Borrelia, but we have also to deal with its friends, which are viruses, parasites, fungi, and other bacteria. What I mentioned before, we have to deal with the toxins. We have to detoxify the body because otherwise we get again a lot of infections. And of course, we have to enhance the immune system. Why chem treatment? We already discussed this today. Microbes can become resistant against normal antibiotics. Bacteria will make a change, as I showed you on the picture, and there will be an overgrowth of other friends, other microbes in the intestine. That's why there are various protocols over the world for people who are very effective in chem treatment with Lyme disease and other chronic infections, like Klinghardt. There is a Bunach protocol and of course the Kielman protocol, which is a mixture of herbals, of detox and products which will enhance the immune system. I told you islets the last 4 years. They have also recommendations about chem medicines. This is a part of it. Number one, probiotics. We heard in our last talk, it's very, very important. And also Professor Puri did show you that. You see there are a lot of vitamins, minerals, fatty acids, specifically for the neurological system, L-carnitine, B12. So there are a lot of products you can read on the internet. For the immune system, and of course if there are symptoms about arthritis like glucosamine, vitamin C. The flex cream, we don't have it in Netherlands, I don't know. The number one, if we look at the chronic infections about the Borrelia, the number one for me and what I see in the literature is toa-free cat's claw. There are a lot of other herbals like Atoba species. One brand is Benderol. Teasel is also used in Germany a lot. I don't know if it's used here in the UK. Ozone therapy can be very effective because it works against all other pathogens too, also on the Borrelia. Biophoton therapy is very effective. There's a lot of research done in Germany, and we can use the zappers to eliminate the intracellular microbes out of the cell, and then of course antibiotics are more effective. If we look at toa-free cat's claw, there are a lot of differences in cat's claw. I think you all know cat's claw is good for the immune system, but there are big differences. The toa-free cat's claw is much stronger. It's 20 till 100 times stronger than normal cat's claw. And this special chemotype is found in Peru. And of course the pharmaceutical industry was interested in this herbal because the natives are using it as a natural antibiotic, and they use it for cancer treatment, purgativum, etc. So there is a lot of research, and for me as a pharmacist, I always want to understand how a herb works, and especially in this case, against microbes and on the immune system. So there is a lot of research you can see and find on the internet. One of the most important ingredients in this plant are the alkaloids, and specifically the POA alkaloid. So they are pentacyclic alkaloids, and if you isolate them and do research, you see they are very strong enhancing the immune system, but it can also modulate the immune system. So in cases of autoimmune diseases, you can also try and to give those alkaloids. Tower-free cat's claw also contains guanovinic acid glycosides. And if you isolate those, they are very effective against bacteria and viruses. From this group, you find a new group of antibiotics, the quinolines. You already saw them today. Ciproxin, norfloxacin is one of the groups which are isolated from this plant. Tower-free cat's claw also contains 3 terpenes. If you isolate them, you see they work antiviral. They have an anti-inflammatory effect. And it contains antioxidants, polyphenols, and proanthocyanins. So the total plant we can use and can be used against microbes, and it enhances the immune system. So it's an interesting plant which we can understand can be effective against the Borrelia and other pathogens. So that's the theory, but what does it do in practice? There is a study done by SAPI from the University of New Haven, and they did a lot of research. Yeah, you can't read it, but you can find it on the internet. And there are publications in PubMed, of course. Interesting in this study is that they compared more herbal extracts against Borrelia species. And they compared it with doxycycline. So that's interesting. What is happening and what they found that the combination of different herbs, like we do with normal pharmaceutical antibiotics, we combine them or we rotate them, are more effective, not only to the spiral form, but to all forms, also to the cyst form, to the round form, to the L form. Not doxycycline. What will happen is what I showed you on the picture. Immediately the Borrelia will go into his rest form, his cyst form, his spore form. And of course, when doxycycline is gone, you see that the Borrelia is duplifying very rapidly. So it's interesting to see, and specifically because it's also compared with doxycycline. The combination of tower-free cat's claw with Benderol was the most effective from this study in New Haven. So I thought it's interesting to show you. Now we were focusing just on the Borrelia. But as we heard today, the co-infections are maybe more important than the Borrelia. And we have to get rid of them, because otherwise the patient will be sick. So you can say, I have a negative Lyme test, the Borrelia is gone. But if there are co-infections, we have to retreat it as well. Okay, we saw that the co-infections can be viruses, fungi, parasites, and other bacteria. What are the chem possibilities? A very broad combination, which is quite effective in my opinion, is oregano, quercetin, curcuma complex. It's available in capsules. It works against viruses, it works against bacteria. Of course, because of the curcumin, it also has a positive effect on the liver, so we're also dealing with detoxification. There is a product which is called EpiGNR. This is effective against viruses and bacteria. There is a para-EpiGNR, which of course works against parasites, etc. It's an ozonated castor oil. This is discovered in the US. And this is a very effective method, like ozone therapy, against and works very broad on different microbes. Not to forget probiotics. I saw that here in the UK, Simprove is on the market. I think that's a very good one because there are a lot of differences in probiotics. Not only because of the ingredients, but also the absorption and the colony forming of those products. So Simprove is good, I think. The amino acids, L-lysine, is very useful if we know there are viruses, and mostly there are. And L-cysteine is effective against the parasites and also works against the eggs which are produced by the parasites. So I made some protocols which I use in the Netherlands. For example, here it's just an example against Epstein-Barr. I think you know all the products, all the ingredients. Lysine, but not in a low dosage. You need it to dose it at least 6 capsules of 500 milligram a day. Vitamin C, more than 3,000 milligram. I think in Germany they said 5 gram, but a lot of people complain, of course, because of their intestines. Vitamin D, K2, in a higher dosage, very effective if there are virus infections. I don't know if you know the herb Cistus incanus. Cistus incanus is well known in Germany, but also in Holland. You can get it in a tea form or in a herbal extract. And it's effective against viruses, but it works also against biofilms. So you heard today a lot of microbes are working together, forming biofilms. And you have to get rid of the biofilm, because otherwise normal antibiotics or antiviral products are not effective. So remember Cistus incanus, and you will be happy. Parasites. Now Hilda Clark, she did a lot of research. There are a lot of publications of her. And if you use the combination of black walnut, clove, and eucalyptus oil, it's very effective against all kinds of parasites. There is a product I already mentioned, Para-Epigenar, which is especially working against parasites. And it does contain the ozonated oil. There's also some black walnut in it, and also contains eucalyptus oil, so that could be much broader than only the combination I mentioned before. L-cysteine already mentioned because of the egg. So it's not only the parasite which is a problem, but some of them are producing 10 till 30,000 eggs a day. And if you add the L-cysteine, that is quite effective. And of course you have or can combine it with a very effective antiparasitical drug, metronidazole. Fungi, if we see parasites, I normally also see fungi. So it's like they are also working together, they have the same environment, and they help each other. Not the medication, but the diet is the most important. As you know, patients should use a sugar-free diet. If not, I can't cure them from fungi. So normally I tell them, and if they don't do, we won't have success. Probiotics, very important. If we see a lot of fungi, and I see it normally with almost 100% of all the chronic Lyme patients. Of course also because of the antibiotic treatment. So it was nice that Dr. Schwarzbach, he said, if you give antibiotics, always give probiotics. Everybody knows, but no one is prescribing it, I see in practice. So people who come with me in the pharmacy, they have a prescription of antibiotics, sometimes 1 month, 3 months, no probiotics. So we, of course, we tell them, but we're telling that for years to medical doctors, and we hope that finally they will prescribe, and also the insurance will pay for the cost of the probiotics, because it's very important. Then a natural product which is very effective against fungi is Kielman, Campsandria angustifolia, a herbal from Peru. Grapeseed extracts, a great product. Garlic, of course, in the diet is very effective against fungi. A herbal from the Amazon, Paudaco, it's available in tea and capsule. It also is enhancing the immune system, but it's also very effective against fungi. And of course, the medication, if not effective with these chem medications, you can give or prescribe the Dextrin oral gel. Important to mention and to explain to all your patients is the Herxheimer reaction which can occur. I don't know if you know what is a Herxheimer reaction, but otherwise the patient will tell you that if you prescribe antibiotics, also natural antibiotics, with the die-off of toxin-producing microbes, they will find that the symptoms will enhance. So they think you're a bad therapist or bad doctor. So explain that if they start with the antibiotic treatment, natural or normal antibiotics, they will get worse. What you have to do is to add detoxification products, or first start with detoxification and not active but mild, because otherwise the fatigue will be worse too. So it's important to tell them it's a positive effect, you feel bad, but you have to go on. If they are too bad in their condition, they can stop for 1 or 2 days, double the doses of the detoxification products they're using, and then go on slowly. Yeah? We already did talk about detoxification, and I mean it mildly, so supporting the detox organs like the liver, the kidney and the lymph. What can we do? There are a lot of products available by nature. I find the herbal Desmodium moleculum interesting. There's a product called Berber Detox, and why it's cheap, and it works on the liver, on the kidney and on the lymph, so you have one product for 3 of it. Milk thistle is of course interesting. In case of the Borrelia and there is a lot of biofilm, it's good to prescribe or advise green clay. I know it's old-fashioned, but it's very effective. Curcuma, already mentioned. Again, the fungi, Quibopedra, it's working on the liver too, and of course on the gallbladder, which is blocked many times with people with chronic Lyme disease. We say others because there are a lot of symptoms with people with chronic infections or chronic Lyme disease. Energizers, which are very important. We saw, and I will show you later, that fatigue is almost 100% with chronic infections. So energizers can be helpful, like coenzyme Q10, acetyl-carnitine, vitamin C of course for the immune system, curcuma for the liver, and Cissus incarnis of course of the biofilm we already discussed. So enough about the microbes, about the pathogens. We also need to enhance the immune system. Again, for that we can give the tower-free cat's claw. Because of the POAs, the alkaloids are very effective in enhancing the immune system. Echinacea, of course, well known and effective in an active infection. Astragalus, curcumin, garlic, mushrooms, combinations of maitake, reishi are effective to enhance the immune system. Vitamins, minerals, if there are of course deficiencies. For fatigue, B12 is already mentioned, of course, B6. Also important, the lifestyle. We can't help the people if they don't change their lifestyle. They need to listen to their body, of course. They need enough rest, enough sleep. So advices in good sleep is also very important. They have to change their diet. Our last speaker we heard diet is very important for our health. A bio diet of course, and GMO free of course. And stress is very important. No stress, because that reduces the immune system, and a dormant infection can become active. Not only the viruses, but of course also the Borrelia. So the question, are there any studies done on humans? There is one pilot study I could find from Lee Cowden and his team. And it's interesting because the group they were treating were people who had chronic Lyme disease more than 10 years. They were given no hope, and Lee Cowden thought, Lee Cowden, I don't know if you know him, he's a cardiologist and an internal doctor, and now he's specialized in Lyme disease and cancer treatment. He did this study because he thought, okay, I should help those people because I see them every day in his practice. This is, of course, a very small study, 28 persons. That's why it's a pilot study. 14 of them, they went on with their medication, so painkillers, antibiotic treatment, etc., depending of the patient. And the other half of this group got chem treatment, like detox products like tower-free cat's claw, for about 10 weeks, and I will show you the results. If you see in the improvement scale, you see that the average improvement after 10 weeks is 75%, so that's promising. But I also like to show you this slide because you have an insight in what kind of complaints chronic Lyme patients will show you to you. So the fatigue, 13 of the 13 patients have fatigue. Stomach pain, 10 from the 13, joint pain, 8 from 13, memory problems, 9 from 13. So this is how you need to read the slide of the study. So it's interesting to see that there are different complaints, but fatigue is the number one, and every chronic Lyme patient will have the symptom, fatigue. Cowden make a whole protocol with more than, I think, 13 or 14 herbal extracts which have an effect on the Borrelia, but also on the co-infections, on the cyst forms, on the biofilm. So it's a protocol of 9 months and can be useful for self-treatment of chronic Lyme patients. I thought, okay, pilot studies are interesting, but for myself, I need a double-blind study. So I did in the Netherlands with 60 patients with 5 medical doctors. And we had a double-blind period of 3 months. And after that, every patient is treated for 6 months, at least, with this chem method. So I used tower-free cat's claw, I used Berber, and I used Kielman for the co-infections. And you see in the double-blind period that the symptoms on a scale of 12 went down in the tower-free group, and the placebo went from the average of 9 to 8, and that, I think, we can conclude is a detox effect of the Berber detox. So I think interesting and promising for chronic Lyme patients. In this case, we had Lyme patients who had Lyme disease for more than 1 year, and they had a positive Lyme test, because otherwise there is discussion. Do you have to feel with a Lyme patient? How can people easily start, or is it for you easily to start to give advices? Of course, there can be a discussion about Lyme. In Holland, we have the ELISA and the Western blot. And if those are negative, the patient has no Lyme disease and can't be treated as a Lyme patient. So, and that's very stupid, of course, because Armin, he showed you the results that almost in 50% of the tests, they can be false negative or false positive. But in Holland, only those two are allowed, Western blot and ELISA. And if they are not positive, you don't have Lyme disease. And that's a big problem for a lot of patients in Holland. I also told you that the maximum amount of antibiotic treatment is 3 months, and in most cases that's not enough if we talk about chronic borreliosis. With this scheme, this is the scheme I used in the study, in the double-blind study. So we have a prevention. We can have acute Lyme, and we can have chronic Lyme. So important to mention that in case of chronic Lyme, we should enhance the dosage of the tower-free cat's claw very slowly, because otherwise we get the Herxheimer reaction and they feel really bad. So that's important. So if you have an acute infection, someone is visiting you, they have seen the tick, we see the bullseye, or we have the anti-inflammatory reactions or the juvenile rheumatitis, of course you start immediately at a high dosage. And of course you combine it in that case with doxycycline or amoxicillin. Yeah, because in that stage the Borrelia is only in his spiral shape, and then antibiotics are very effective because it's not intracellular yet. If we have to deal with chronic Lyme, that's what I mean, Lyme disease, we discover after 1 year or more, the Borrelia is in different forms because it changes its morphological forms. We have cis forms, we have L forms, we have round forms. They should be treated at least 6 till 9 months, and then we find, in my experiment, a success, a positive success, about 65%. And if we were not successful, we have to add other chem methods against co-infections. So normally we ask the patient to give a telephone call or to come again after 2 weeks, after 1 month, after 3 months. And then we have to look, of course, also by lab research, which co-infections are available at that patient. And then, of course, we have to change or to add more products to the protocol. I did show you some protocols or products you can use from chem products for detox. I showed you some protocols against bacteria, fungi, viruses, parasites. I showed you some products which you can use to enhance the immune system, and others, the energizers and anti-inflammatory products. Then I come to my conclusions. And of course you heard it today, we don't have to deal with one microbe in case of chronic infections. So the Borrelia is important and is many times misdiagnosed, is missed, but we also have to deal with other pathogens too. And of course, first we need a good diagnosis, we need good symptoms. I think the scheme of Ahmed Schwarzbach is interesting to see what kind of co-infections are more prominent. And of course afterwards we can do a lab test. In Holland people have to pay for those tests themselves. And I saw the price list and I think that can be very expensive for the patient. After that we can prescribe or advise the right antibiotic treatment, and if necessary we can add the chem treatments. There is enough research and publication I think you can find on PubMed. I do myself. And the most important one, I can't give a protocol for every patient because we have to treat them individually. How long do they have Lyme disease? What kind of co-infections do they have? What is the condition of the detoxifying organs? And what kind of symptoms are prominent at that patient? So it's individual treatment. I'd like to thank you for your attention, and if there are some questions, I try to answer.